Okay, so this is a tutorial on the muscles of the neck which line the anterior triangle. So the anterior triangle of the neck is defined by a few boundaries, so the anterior border of the sternocleidomastoid, the midline, and the inferior border of the mandible. So this is the anterior triangle we're looking at here, and there are several muscles which line this triangle. So you've got the suprahyoid muscles which lie above the hyoid bone, and the infrahyoid muscles which lie below the hyoid bone. So the infrahyoid muscles are known as strap muscles, presumably because they look like a strap, or I don't know, something like that. So the suprahyoid muscles lie above the hyoid bone, and the hyoid bone is important because it serves as a point of attachment for several muscles. The muscles of the tongue attach to the hyoid bone, and it's important in swallowing. So there are four suprahyoid muscles. You've got the digastric, the stylohyoid, the mylohyoid, this big fan-shaped one, and superior to this you've got the genohyoid muscle, which I'll show you in a moment. So the stylohyoid muscle is this muscle here, which connects from the styloid process of the skull to the lateral surface of the hyoid bone, lateral area of the body of the hyoid. So the name really gives away its origin and insertion, which is quite useful. So it originates on the styloid process and inserts onto the lateral area of the body of the hyoid bone. So the hyoid bone lies at rest at the level, roughly at the level of the base of the mandible, and lies just a little bit above the thyroid cartilage. So several muscles attach here. So this is the stylohyoid muscle, and obviously you've got these on both sides. So the next muscle is the digastric muscle. So this is this muscle which loops all the way here, attaches to the hyoid bone, and also attaches on the inside surface of the mandible. So it attaches in the digastric fossa and also on the medial surface of the mastoid process. So the digastric muscle is called digastric because di means two and gastric means bellies, so it's a two-bellied muscle. You've got the anterior belly and the posterior belly. So the posterior belly originates on the medial surface of the mastoid process and inserts via this tendon onto the hyoid bone, and the anterior belly originates on the digastric surface fossa on the inside surface of the mandible and inserts via the same tendon. So this muscle has various actions depending on which bone is fixed. So the hyoid bone can move up and down, and the mandible obviously has several movements. It can protrude, retract, depress and elevate. So if the hyoid bone is fixed in place, then the digastric muscle will act to open the mouth, so it'll pull the mandible down, opening the mouth. So you can imagine this action if you have, so the mastoid process is obviously fixed. If the hyoid bone is fixed in place, then the anterior belly of the digastric muscle will pull the jawbone down and open the mouth. If the mandible is fixed, however, and obviously the mastoid process is fixed, then the digastric muscle, both bellies, will cause the hyoid bone to elevate. So it depends which bones are fixed. So it's quite an unusual muscle because it has three attachments. So the next muscle is the mylohyoid. So I'm just going to rotate the model around and we're going to look at it from underneath. So you can see the digastric muscle. It lies inferior to the mylohyoid, which is this fan-shaped muscle here. So this muscle forms the floor of the mouth, and this muscle can elevate the hyoid bone. So it's attached on the inside surface of the mandible, and it originates on the mylohyoid line on the mandible, and it inserts obviously onto the hyoid bone. So these muscles, separate muscles, blend in the midline and originate on the inside surface of the mandible on the mylohyoid line. So it lies superior to the digastric muscle, and it supports and elevates the floor of the mouth, and it also elevates the hyoid bone. So that's the mylohyoid muscle. So just superior to the mylohyoid muscle, you've got the final muscle, the suprahyoid muscle, which is the geno-hyoid. So if I just remove the mylohyoid, you can see there is a muscle, a thin muscle, which runs from the hyoid bone to the inside surface of the mandible again. So this muscle originates on the inferior mental spine of the mandible. So this is a little thing that lies on the inside surface of the mandible, and it inserts onto the hyoid bone. So again, the action of this muscle depends on which bone is fixed. So I'll just remove the mylohyoid on this side just so we can have a look. So we've got, so you can see this thin muscle. So it lies superior to the mylohyoid muscle on its medially. So you can see this muscle above it. This is a muscle of the tongue. This is the genioglossus muscle, but ignore that for now. Just looking at this thin, so you can see this thin muscle running from the hyoid to the inside surface of the mandible. So it depends on which bone is fixed as to what the action of this muscle is. So if the hyoid bone is fixed, then the geno-hyoid will open the jaw. It will pull it downwards and inwards. Whereas if the mandible is fixed, it will elevate the hyoid. So the word geno refers in Greek or something to chin. So if you see the prefix geno, it refers to chin. So the genioglossus, this tongue muscle here, attaches inside on the chin, on the inside surface of the mandible. So the geno-hyoid runs from the inside of the mandible to the hyoid bone. So those are the 4 suprahyoid muscles in the anterior triangle of the neck. So you've got the stylohyoid, the digastric, the fan-shaped mylohyoid, and you've got the geno-hyoid.